Hello again. My name is Parag Bharadwaj, and I would like to introduce our guest today, Jill, to our audience. Jill, would you mind introducing yourself and sharing a little bit about yourself with our viewers?
Yes, hi, my name is Jill Zoet. I am a registered nurse in the field of hospice and palliative care. I've been a nurse for 40 years and been working in the field of hospice and palliative care for the last 20 of those years.
Great. So what is your earliest recollection of wanting to be a nurse, and what guided you to choose this profession?
You know, that's very easy for me to remember. As a child, um, I was in a very traumatic motor vehicle accident. I was hit by a car walking and spent about 8 weeks in the hospital myself as a child. I had my 9th birthday in the hospital setting, and I knew it directed my purpose for the rest of my life. I was lucky enough to live through that with the help of people who cared for me and provided expertise in their work. But I also knew what made a good nurse, and looked forward to particular nurses coming on shift that were particularly caring. And that experience as a child really directed my path from there forward. And I felt very lucky, despite the trauma that I went through. I felt very lucky to have walked away from that with my health and with guidance about what my purpose would be.
So you made the best of a suboptimal situation.
Correct.
And so that event gave you the opportunity to be exposed to a lot of caring individuals in the form of nurses.
Mm-hmm. Yes.
Any
Yes.
particular experience you remember that sort of said, okay, yes, I want to be like her? Any particular nurse, any particular experience?
I think a couple of the nurses that I can remember in my heart, but I don't remember them by name, or even what it was about them. I was a bedridden child. I had a lot of orthopedic injuries, and was attached to a bed for about 6 weeks. And I don't remember maybe what it was about those particular nurses, but they were enjoyable. Their presence was welcome in a difficult time. So again, it was a relationship with them.
And it was life-changing at a very early age. It gave
Yes,
direction to your life.
It very much did.
Great.
Very much did.
So tell us about your journey as a nurse and what guided you towards becoming a hospice and palliative medicine nurse.
I had perhaps again the good fortune of death being familiar as early in my life. I came from a very large extended family, and my mother was the youngest of 12 siblings, and they were spread out over 25 years. She was the youngest. So there were a lot of older siblings and older grandparents. I mean, older aunts and uncles for me, and grandparents who died in my childhood, in my teenage years. And so being part of the ritual of death that in this country, was visiting with family members at a funeral home. Those were experiences that became familiar and comfortable to me. So death was not to be feared by me as a child. And even in childhood, we were included in that. And while it's not my preferred, setting, perhaps now as an adult, I'm grateful for those experiences because it gave me the opportunity to just see to have repeated exposure to that, so that I established some comfort in the presence of people grieving, right? But then my nursing career started out in the field of oncology. I had the great fortune of being able to be employed at the University of Minnesota hospitals, where there was, it was a tertiary care center, and people came from all over the Midwest to seek care there. And back in those days, it was pretty intense for people to come to an inpatient setting to get treatment that is now done very much on an outpatient basis, because we're able to control and manage the side effect related experience that allows people to come and go. But back in those days, it was an inpatient experience. And I guess our unit decided that it would split itself into nurses who preferred to work with the surgical patients in oncology versus people receiving chemotherapy versus people more there for palliation. Because again, people maybe had journeyed 400 or 500 miles away from home to come there for care. And I found myself, interestingly enough, gravitating away from and away from those radical surgical procedures and care of those patients, and away from the suffering that 5 days of inpatient chemotherapy created for people. While I had those experiences in the first couple of years and learned a lot, I also was so impacted by the suffering that patients and their families experienced in the treatment of cancer. And I really gravitated towards providing comfort and calm and true bedside care of those who were done with that suffering and wanted their suffering eased, and to focus on the joys at the end of their lives. And so when we had that opportunity to kind of declare a subspecialty, it just felt very natural that that's where I belonged. So I never got to exactly replicate that again, but that was the beginning of my academic interest, and pursuit of lifelong learning in end of life care.
It's very interesting because I heard a few things. When we take care of patients, especially, when you talk about your career, that spanned over 40 years, I'm assuming that when you started off as an oncology nurse, the greatest push was to keep trying to keep a patient alive as long as possible.
Yes.
And even today, we of course, we want the best outcome for our patients, but there are patients that don't respond to treatments and don't have the outcomes that we wish for them. And so it seems like your earlier experience within your family and, with death and you being exposed to it, you had a sense of comfort with the concept and how to deal with the situation. And it
Yeah,
just eased naturally into your job, which, for the most part, most healthcare workers and professionals are scared to deal with themselves.
absolutely. People would say to me time and time again, Parag, how do you have such a comfort level with that? It's so sad. Why would you choose that? Or, how did you come as a 22-year-old person to have those skills, or to have that innate comfort level helping people through that, because it's just so painful. And I guess I found that to be an interesting question, because I did feel very prepared and I did gravitate towards that. Whereas the suffering that I was helping, the suffering that I witnessed, that I was a party to by by administering chemotherapy or taking care of a 93-year-old woman away from her family, having a radical, surgical procedure. That was uncomfortable to me. That was not the journey that I was wanting to be part and parcel to, but rather it really fulfilled that piece of me that wanted to provide comfort, even if it meant, attaching that comfort to end of life.
Right.
It just was, it was very, very clear early on for me that I had a high comfort level there. And I was grateful for that because it's important.
Right. So it seems like what I'm hearing is that there is suffering that you saw that originated from a patient's disease, and you were working in the field of oncology, so cancer-related issues. But there's also suffering due to the treatments that were provided to patients. And
Exactly.
right, and you're absolutely right. Patients don't have to suffer as they go through that process, and that's what the underlying theme that I'm hearing is. You just didn't want to see your patients suffer.
Yes,
Right.
yes. And again, there were choices. There were choices. People were at a high level facility, very willingly so, hoping for good outcomes. But we're not in charge of those things. We still to this day are not everyone is going to respond favorably, and it's not to treatment, and um, it's not has nothing to do with that person's soul or well-being or who they are as a person or choices that they've made. It's just the disease process. And so being clear about that and helping people understand and accept that was much more where my skills lie. You would never want to go to an emergency room and have me greet you at the door, because I would be very ineffective in that setting, right? I tell people I would probably be in a corner with my hands in my pockets, because I'm not comfortable with the skills that are needed in that environment. Those are just not my skills.
Right.
And I came with a different set of skills, and I had different desires I wanted to actualize the skills that I think I did bring to the table. And hospice and palliative care certainly was an opportunity to do so. But do I believe that those skills are innate? Not necessarily. I believe that they can be learned. And it's important that more people learn the skills that are required, because all of us live on a continuum. All of us care for people on a continuum, and they need different things from us at different times. So it's important to work on developing those skills that meet your patient and family's needs when appropriate.
Absolutely. You're right. We all have different skills and different strengths, and that's why we work as a team. And that is at the core of palliative medicine and hospice. So, uh, can you elaborate a little bit about perhaps if that was something that attracted you to these fields, because the team-based approach, it's not just the physical, but also the social, the psychological, the spiritual aspect of things.
Yeah, it very much so. I was glad, like I said, to have the opportunity in that big clinical setting to sort of subdivide based on what our skills and interests were, because those were the things that were meaningful for me. And there was respect for that. I was providing that care alongside um, team members who were providing a different aspect of that care. And it is teamwork. It is expressing the whole person, and meeting with team members on a regular basis to oops, sorry for the interruption there.
It's okay. No worries.
I'm losing battery. I need to pause for a moment and get.
Okay. All right, we're back. So you've had a pretty illustrious career that has spanned over 40 years. So Jill, could you share with us what you learned from your experiences with your patients and their family members?
You know, they've taught me a lot. I'm always humbled by the notion that you can have a prescribed set of thoughts about how you're going to approach a situation, and as soon as you enter into that individual encounter, it's while you do bring your past wisdom, it's always going to be unique, and you have to be prepared for that and allow that to happen. From the situation with Graham, Jennifer's grandmother, I learned the power that we have in this role if we are there and present, that people do need us to help them navigate these waters. It is not still to this day common knowledge of what is available and what our options are when we have a life-limiting illness. The focus is still on curative treatment and life-prolonging treatment, because I believe that people aren't knowledgeable or comfortable having those conversations. And I've just learned what a difference it can make when that thoughtfulness is provided to people.
Thank you. Now, you've also seen a lot of suffering. You've seen patients overcome their illnesses. Sometimes that can be a long process. Sometimes they succumb to their illnesses. You've seen, family members in different situations react different ways. And you've also come across clinicians as well with their own perspectives. What are some of the pearls you would like to share with us in terms of how we should live our lives?
Boy, that's a big question. You know, expert symptom management does really matter. And I think that being very knowledgeable about things that we can utilize to absolve people of some of their suffering is really important, because it does allow people to live their best lives for whatever is going on, whatever their disease process is. Paying attention to expert symptom management really makes quite a difference in providing quality, and that's what people desire. Yeah, I've gotten better as I've aged with how to approach difficult situations, because they are common, both with our colleagues, with patients and family members. And I've softened in maybe not needing everyone to instantly believe what I believe, or that because my lived experience has been different than theirs. But I really want to continue to expand knowledge of what's available for people, that it's okay to make these decisions, that life still needs to be about what you need it to be, and for you and your family, and we're not there to just please or go along with those who are in charge or making decisions or providing care for us. It is really up to us. And I'm now going to attempt to retire, to try and live my best life at this point forward, because we are making a move of 400 miles to be closer to family and the joy that can come from that.
Thank you. Thank you for all your service. And I'm sure you've touched a lot of lives. We heard from one such experience with Jennifer's grandmom, Graham. And one of the things that really struck me was after we did the recording on how she shared how the work you did really touched her soul. That's a very powerful statement. I think that's the best compliment
It is.
somebody can get, in their line of work.
Mhm.
So I hope we will stay in touch, and I hope we will get to tap a lot more of the wisdom that you've gained over the years. Any parting thoughts?
That nothing would please me more at this stage in my career than to stay involved in the mission of expanding palliative and hospice care, and normalizing it, and increasing access, and mostly helping people just feel that they have a place to turn to when they need this expertise.
Thank you very much. And we'll keep in touch, and we'll look forward to having you back again soon. Thank you.
Yes, thank you so much for the invitation. Thank you much. Take care.
Did you like this story? If so, please subscribe to this channel and like and share the video. Want more? Buy the book, Stories from the Edge of Life, available now on Amazon for more stories like this. All proceeds support Palliative Care Network, a nonprofit dedicated to alleviating suffering and improving the quality of life for patients facing end-of-life issues. Consider extending your contribution by donating through the link below. Thank you for your support.